Hey guys, so now let us try to simplify the cranial nerves and the columns. So that there are in total of 7 cranial nerve columns that you need to know. Now we need to understand the basic concept of neural tube first. The neural tube has two plates, alar and basal. So the basal plate is the ventral one and motor located ventrally. So BMV, basal, motor and ventral, whereas alar plate is dorsal and sensory. So SAD, sensory, alar and dorsal. So SAD, BMV. Remember it like that. Now when the neural tube starts to fold ventrally, there forms the columns around the fourth ventricle. So there are 3 efferents and 4 afferent columns. So sensory is afferent, right? Sensory is A, afferent. So there are 4 afferents and motor is efferent. So basal plate is motor, so it is efferent, 3 efferents, and sensory plate is afferent, 4 A's. So now there are 7 columns. You need to remember that one column is not there, that is SSE. Special somatic efferent is not there. GSE is general somatic efferent. SVE is special, visceral and efferent because it is located ventrally, and GVE is general visceral efferent. Now we need to understand the individual column and the nerves involved in it. So general somatic efferent involves the muscles of extraocular muscles and tongue muscles. So extraocular is 3, 4, 6 and tongue is 12. In extraocular muscles, we usually learn it as SO4 and LR6, right? Superior oblique is 4 and lateral rectus is 6, and the rest all extraocular muscles are by 3. So 3, 4 and 6. And the tongue muscle is separated by 12. So this completes the first column. Second column is special, visceral, efferent. So the special thing here is about the pharyngeal arches. So now let us learn about the pharyngeal arches. So pharyngeal arches are 5 again. Fifth one is missing. Okay. So first arch is 5th, second 7th, third 9th and 4th and 5th together 10th. Branches of 10th nerve. So 5, 7, 9, 10 are the mixed cranial nerves, and those are the nerves involved in the pharyngeal arches. So remember it like 5, 7, 9, 10 pharyngeal, whereas parasympathetic is about 3, 7, 9, 10. Only one number changes. So remember it as pharynx, PH is 5. So when you hear it, PH is fa and 5. So 5, 7, 9, 10. Whereas parasympathetic is 3, 7, 9, 10. Okay. So now you have to involve this 5, 7, 9, 10 in the second column. First is for mastication, second is for facial nerve, third is 9th, and 4th and 5th together is for 10th nerve. So now involve this 5, 7, 9, 10 in the second column of the cranial nerve columns, which is special, visceral, efferent, SVE. Mastication, facial, palate, pharynx and larynx muscles. The third one is general visceral efferent. Here you involve the parasympathetic nerves, that is 3, 7, 9 and 10. Okay. 5, 7, 9 is fa for 5, that is pharynx. Okay. So 3 columns are done now. SSE is not there. Now let us come to the main table here. So here the red ones are efferents, that is motors, GSE, SVE and GVE, whereas the green ones are afferents. Okay. So you have to remember it as GSG alternatively. Start with the G always. So till the red one end with E, GSE, GSG. And the next 4 columns, that is afferent columns, are sensory, written in green. Again start with G. So G, S, G and S. S, G and S. So all these are efferents. Okay. GSG and again GS, GS. Remember it like that. Okay. So coming to the first column, GSE, I have already told that it is involving the muscles of eye and tongue, 3, 4, 6 and 12. Here again it is divided into midbrain, pons and medulla. So the basic point here is midbrain involves the nuclei of 3rd and 4th nerve. Pons is next 4, 5, 6, 7 and 8, whereas medulla is next 4, 9, 10, 11 and 12. So since 3, 4 is involved, it is for midbrain. 6 is involved, it is in pons. 12th is located in medulla. So it is like that. Now coming to SVE. SVE is pharyngeal. Fa for fa. That means you have to start with 5. 5, 7, 9 and 10. Here you can include 11th nerve also. In the next one, that is GVE, parasympathetic, it is 3, 7, 9 and 10. Okay. So 3, 4, 6, 12, 7, 9, 10, 11 and 3, 7, 9, 10. So here the 11th nerve is involved, and 9, 10, 11 together constitute nucleus ambiguous. Remember that point. 9, 10, 11 together constitute nucleus ambiguous. Third now is Edingle-Westphal nucleus. 7th and 9th are salivatory nucleus. 7th is superior, sa for sa, superior, and 9th is inferior. Okay, these are salivatory nucleus. Since this is the parasympathetic column, you will have those nuclei names also. Next 4 columns, remember it as Jiva and Seva. Okay, if you remember like that, it will be in a rhyming sense, Jiva and Seva. So here it involves only 7, 9 and 10. Here remember, nucleus tractus solitarius is involved. Nucleus tractus solitarius name has N, T and S. N is for 9, N 9, T is 10, S is 7. Okay, N is 9, T is 10 and S is 7. And next column GSA, it involves 5th now. You just need to remember that it involves 5th now. Only one now, that is trigeminal, which is the longest nucleus. Now coming to SSA, remember I have written it as SSA, right? So you can make 8 out of it. Both SS are in this, so you can make 8 out of it. So SSA is 8th at the pontomedullary junction. So yeah, this is the table. And except for the first and the last columns, all the other columns involve 7, 9, 10 nerves in it. So look at there, 7, 9, 10 in all the middle 5. First and last does not have 7 and 10. So yeah, this is about the cranial nerves and the columns afferents, efferents, basal plate and alar plate. So here I have included the screenshot of all the nerve columns. Once you can go through that. So the entire image is covered in the previous explanations. If you like these kind of videos, please like, share and subscribe, and you can ask me the topics that you want in the comment section. Thank you.